Very important month, as July is Uterine Fibroids Awareness Month. Even Congressman David Scott has introduced a resolution. There are thousands of women in Georgia, 11 million across the United States that are affected, which represents one of the most prevalent reproductive health problems in our nation. With us is a station friend. Dr. Neel Patel is here. Thank you for joining us on the show, brother. How are you, man?
Good. Thank you guys for having me.
First of all, before we begin, congratulations are in order for you. I understand you were about to be a new father as well.
Yes.
There you go. So tell everybody who's listening right now about uterine fibroids.
So fibroids are non-cancerous tumors that occur in the uterus, and they can cause symptoms such as heavy menstrual cycles, pain, pelvic pain, pressure, frequent urination. If the fibroids are large, it can press on the urinary bladder, making you go to the bathroom more frequently, and it could even cause painful intercourse.
Wow. Sharon?
You know, some of these symptoms you talk about, we're used to that as women, you know, as you grow, you mature. So how do we know that it's fibroids? And by the way, staggering numbers, and just doing the research here, 80% of Black women will be affected by this.
Yeah, of those patients, people, a vast majority will not have symptoms. So most patients with fibroids may not be symptomatic, but of those who do have these symptoms, which I've talked about, they can have, be more symptomatic.
You know, a lot of women find out they have it when it comes time to have a child.
Yes.
And then oftentimes it's an issue. Talk about that.
Yeah, so fertility, there's many factors which go into fertility. The one thing is the number of eggs. Women are born with the set number of eggs, and they decrease as you age.
Right.
The quality of the eggs also, as you age, your quality of eggs decrease. And so when you're 28, the vast majority of your eggs are good. And when you're 35, 50% are good, 50% are bad. And when you're in your early 40s, it could be up to 90, 95% of the eggs are bad. So age, fertility decreases naturally. Even without fibroids, as you go through your 30s, your fertility drops. Other factors in fertility include, are your fallopian tubes open? Sometimes they can get scar tissue and be blocked, and that can cause issues with pregnancy. Concerning the uterus, fibroids can cause issues with pregnancy. Lots of times people are pregnant with fibroids and they don't cause any issues. When you start to have fibroids closer to that inner layer of the uterus, it can start to affect whether the baby can implant, if it grows, preterm labor, things like that. So a fibroid on the outside of the uterus may not cause issues if it's small, so those are just some of the main factors. Also, a male factor is sperm good.
Okay. JR?
Yeah, how can it's crazy to listen to what Sharon said, talking about 80% of Black women. This is something that affect them. Is this because of diet? Is this something genetic that gets passed down? Why is this the case?
Yeah, the true cause of fibroids still isn't known. Genetics is a part of it. Women of African descent are a higher risk of getting fibroids. If your mother had fibroids, there may be a higher chance you have fibroids. And the exact cause of the fibroids is not known. It is known that women of African descent may have be more symptomatic at an earlier age, have a higher number of fibroids, and they may have larger fibroids compared to other races. So it is definitely a concern.
My history of remembering this is that so many women that I knew that went through this had to have very serious procedures to remove these fibroids. And this woman just called and said that she had one the size of a watermelon in her. Like, how do you get something like that out?
Yeah, so the treatment methods in the past have been hysterectomy over 25 years ago.
Okay.
There's other surgeries, myomectomy, where they cut out the fibroids. Those are the two main surgical type procedures. It depends on number, size, location, things like that. And
right.
We assess this with, first people get pelvic ultrasounds to see if they have fibroids, and then we do MRIs to get a better look at it. So that's kind of the treatment algorithm. So as far
So when you say hysterectomy, for somebody that's listening, what does that mean?
that means where they just remove your whole uterus.
So if you had a fibroid and you had a hysterectomy, then you're not getting pregnant because your uterus is gone now.
Correct. So currently, it's surgery for if you want to get pregnant is going to be myomectomy, and where they cut out the fibroids. The other part of it is, when you go through your 30s and 40s, these fibroids tend to grow, and sometimes even after surgery and things, when they cut out the fibroids, some of that were very small, or if it wasn't only fully removed, can grow over a few years. And I see a lot of patients who've said they've had surgery and they had their symptoms come back. So that's kind of, in your 30s and 40s, these fibroids tend to grow, and then when you go into menopause, they shrink.
Is it now the surgery that they have now? There's a surgery that's a slight incision, and is there like lasers or something where something makes it easier now so that the woman is not taken out like that?
Yeah, for surgery, they do laparoscopic surgeries where it's less invasive. The procedure I do is the uterine fibroid embolization, where I go make a 5 millimeter incision in your wrist artery, the radial artery, and I put a long, tiny catheter down to the pelvis. And, under X-ray guidance, and I inject these small, tiny beads that block the blood supply to the fibroids, cutting off the oxygen so the fibroids die and shrink down.
Okay, let's go to line number 3, Melinda and Marietta. Melinda, go right ahead with your question.
My question is, how do you tell the difference in symptoms between fibroids and endometriosis?
Yeah, sometimes the symptoms can overlap a lot, and it's just difficult to diagnose. They both can have pelvic pain, heavy bleeding, and things like that, and infertility issues. So, doing MRIs sometimes can pick up the endometriosis. Lots of times, endometriosis is diagnosed through laparoscopic surgery, where they actually can see the scar tissue formed.
We had a celebrity, Gabrielle Union, who actually had written a book about it. She was on TV about it, and it comes to find out she had the endometriosis. Mm-hmm. And she had tried 20 times when in vitro to get pregnant, and every time it wasn't working, and she didn't find out about the endometriosis until later on. Why is that? If it's such a common thing, why are these like this other woman that called in? She said, "I can't breathe. I can't do this." We started the conversation by saying how prevalent it was amongst African American women. Mm-hmm. These African American women are having these symptoms, but they're not being diagnosed with what the problem is until much later on. Why is that?
Yeah, it's a lot of patients I see, they kind of just deal with their symptoms, and they just suffer for time, and that becomes their new normal. So anybody who's having symptoms, my main advice is to go get checked out by your doctor.
Before the next call, Sharon?
Prevention, because like Frank said, 80% of African American women, 70% of white women, some of the data that we have here, it suggests that low levels of vitamin D, obesity, that could raise your risk, even sexual abuse, in children. So is there a way to guard against this?
Yeah, it's with the genetic factors. That's kind of how you're just.
It is what it is.
Disposition, but certain factors like, just healthy diet, exercise, staying trim. Fat cells produce estrogen. These fibroids love estrogen, so they grow off of that. So, being healthy and fit, eating vegetables, low red meat, red meat, hormones, things like that can cause them to grow. So, and a vast majority of those patients with those numbers are not symptomatic, but those who are.
JR?
We can go and check in with Janet on the phone, line 2 from ATL.
Hi, yeah, my question is, I'm 46. I had fibroid surgery about 10 years ago, followed by a hormone that, I guess, put me into premenopausal, had hot flashes. So I took that for about a year, and now they are back. And my doctor's recommending a hysterectomy. And also, we've been trying different birth control pills because I hadn't been on the pill. So about a year ago, I got back on pills to try to control them, and we're seeing if that works. I really don't want a hysterectomy. And she also mentioned, my doctor mentioned a hysterectomy with leaving the ovaries in there. But what other options might I have being closer to premenopausal? Because I'm just wondering, would they come back that fast again before I get to that stage?
You know, this procedure, the uterine fibroid embolization, may be a good option for you because, it will take care of all the fibroids. And, hormone medication, if it controls your symptoms, it's good, but sometimes it's a Band-Aid. So once you come off of it like you did, you start having your symptoms again, which could include heavy bleeding, pain, cramping, and things. So, the UFE is a good non-surgical option.
Marjorie Coley is here with Dr. Patel. Marjorie, what are some of the things you see, in your experience with this here in Atlanta?
Well, I meet a lot of women who suffer from fibroids, but the problem is they don't know they have fibroids. And the young lady was asking me here in the studio, how do you know if you have fibroids? Well, if you have heavy cycles, if you have pain, and when I say pain, I mean if you feel like you have to take, some aspirin or medication or something when you have fibroids and you have pain, when you have a cycle and you have pain, then you definitely are having pain. You're not just having cramps. And if you have urinary frequency, or if you go to the bathroom and you can't really use the bathroom, but you feel like you have to go to the bathroom, those are all symptoms. If you have painful intercourse, those are symptoms as well. So a lot of times women don't know they have fibroids. They come up to me and they tell me about their symptoms, and I tell them, well, you need to get an ultrasound done. The ultrasound will show that you have fibroids. It may not show how many you have, but it'll show that you have some fibroids. When you have the MRI, that'll show a lot of things. It'll show if you have endometriosis or adenomyosis. It'll show how many fibroids that you actually have. And then you can decide what you're going to do. But hysterectomy should be your last option. It really should be. You should find out if you have fibroids, if you are a candidate for UFE, that's what you should find out about first before you get a body part taken out.
July is Uterine Fibroids Awareness Month. Dr. Neel Patel is our special guest. Sharon Reed is sitting in. Sharon?
It's just so fascinating to learn about this. So many women affected. Dr. Patel, you performed the latest UFE procedure through the wrist. You talked about that. But go over it again because this really works for so many women.
Yes, it's got a success rate of 90 to 95%. So what we do is we go through the wrist artery. Incision's only 5 millimeters in size, and same way if you've seen an IV in the vein, it's the same caliber type tube in your artery, in the radial artery in the wrist, and it goes all the way down to the pelvis. And then in the uterus, we inject these tiny, tiny beads that are very barely visible, and that cuts off the blood supply and oxygen to the fibroid, causing them to kind of have a heart attack and die and shrink.
Tell everybody if you can, because there may be some people listening don't even know what a fibroid is.
Yeah, so fibroids are, these non-cancerous growths that occur on the uterus, and they tend to grow in your 30s and 40s. Most people may not have symptoms, but those who do, they can cause a lot of issues such as heavy menstrual cycles, pelvic pain, pressure, frequent urination, painful intercourse, low back pain, inner thigh pain, and these fibroids, when you go into menopause, usually they shrink, but in some cases they just stay.
Wow. JR?
Ooh, what are some preventative measures? I mean, just out the box. I know a lot of times we wait until it's way too long to actually go and get things checked out.
Yeah, healthy living and diet, exercise, that's one of the things you can do. These fibroids love estrogen, so they grow with more hormones. So fat cells produce estrogen, and that causes the fibroids to grow. So just healthy living, eating vegetables, no red meats and things like that.
And I just wanted to add also, women should be mindful of their stress level. I had fibroids. There was a lot of stuff going on in my life at one point, and I do believe that's when fibroids, either they were already there and dormant, or they decided to kick up
with
and
the stress level.
Yeah, with
Wow.
the stress level, because there was a lot of stuff going on. So I always tell women, if you have stress in your life, give it 5-10 minutes if you have to, then you have to let it go, because it can cause a lot of health problems when you have stress in your life.
Let's check in on the phones. Let's talk to Camille in Lawrenceville. Go ahead with your question.
Yes, I was calling because I've dealt with fibroids for like over the past 2 years, and I have a large fibroid on my uterine wall. And I went through every test, I went through every procedure, and what has happened now is they've given me progesterone to control my bleeding. But I have had no resolution to having these fibroids removed.
Yeah. What type of? You said you had procedures done. Which ones have you had?
I'm not sure exactly specifically, but I know that because of my excessive bleeding, they've just been trying to monitor them.
Okay. Yeah. Sometimes
I literally have to miss work.
Yeah. Sometimes getting a MRI is good just to get a full picture.
Right. I've had an MRI. I've had where they checked to make sure it wasn't cancerous. I've had literally every test. I even had an IUD, and they ended up, the IUD is gone. We can't even find the IUD.
Oh.
So I literally have had a lot of procedures, and he said it's equivalent to me being 16 weeks pregnant.
16.
That's how big it is.
Yeah. And how old are you?
I'm 38.
38.
And I have a lot of fibroids. It's not just one.
Yeah. And it's sometimes, in your 30s and 40s, they tend to grow. So that's
right.
You've been more symptomatic. You may have had it, when you were early 30s, and over the last few years, it's been growing. So that's why you're more symptomatic. So, yeah.
Right. My concern, because I'm not sure if your procedure may be probably the next option because of how this has really taken over my life, over the last 2 years. So,
yeah.
What's your information where she can reach out to you?
Yeah, at AtlantaFibroidClinic.com.
Okay.
You can find a lot of information on there, and you can. Our phone number is 404-977-1238.
All right, let's go to line number 1, Contessa in Atlanta. Go right ahead.
Hi, my question is, what if you already have the UFE, and instead of them shrinking all the way to nothing, they end up calcifying? What surgery do you do after that?
So, are your symptoms? Are you having a lot of pain, or is it what type of symptoms are you having now?
I still have the heavy bleeding during my cycle. I'm anemic, and it's just very frustrating. It only shrunk a little bit, so I didn't get any relief. Yeah. And I still frequently urinate all the time.
Okay. The ones that have calcification on the edges, those will not shrink as much. Are you in your 40s, or how old are you?
Yes, I'm in my 40s.
Sometimes as you get older, the fibers can get calcium on the edge, and those typically won't shrink as much. But getting a MRI, a recent MRI, sometimes there may be other fibroids or that are still alive, and the dye can check to see if they're still alive.
All right. Marjorie, any last words?
I just want women to be aware. July is Fibroid Awareness Month. If you are experiencing any symptoms like heavy cycles or pain or urinary frequency or constipation or painful intercourse, you have to talk to your doctor. Your doctor may not ask you those questions. You may have to go to your doctor and say, I have these symptoms. Then your doctor will order an ultrasound. From the ultrasound, you have an MRI. If you have fibroids, then you have to decide, what do I want to do? Do I want to have surgery? Do I want to have a myomectomy? Do I want to have a hysterectomy? Or do I want to try something less invasive first, which is what you probably should do? And UFE is 95% successful. I had it. I mean, I'm living my best life.
You look great.
I'm doing great. You know what I mean? And so it's just worth it to give that a try, to find out about it. Just be aware of your body. Be aware of what's going on. Why would you want to suffer in silence and not do anything about it? Why would you want to just keep padding up and taking extra clothes to work and bringing a towel so you can sit down so you won't mess up your chair at work, which happens. So you want to make sure that you're aware of what's going on with your body during Fibroid Awareness Month and do something about it. And UFE is, an excellent option for many women, but you have to decide you have to find out if you're a candidate, and that's something Dr. Patel can help with. Dr. Patel can help with, finding out if you're a candidate for this procedure. So like he said, AtlantaFibroidClinic.com. You can call our office. You can call me and ask for me, Marjorie, and I'll be happy to answer any questions that you may have.
Doctor, she said something very interesting. She said, when you have these symptoms, you should get these checks. But you started the conversation by saying that you can have fibroids without the symptoms.
Correct.
So why would you wait until you have symptoms if you could already have them? And what I'm hearing through the conversation today is that a lot of women are finding out they have them in their 40s, and they probably had them in their 20s. So why are we waiting to get tested?
Yeah, it's kind of one of those things where in medicine, if it's not bothering you, we don't treat a lots of times. So it's case by case. So if it starts, a lot of people, they just deal with their symptoms. They don't think they have problems, but they actually do, and that's what I see a lot. Like yesterday, I saw somebody who was having heavy cycles and pain for 4 years, and then finally her doctor decided to do an ultrasound, and then it showed that she already had large fibroids. So she kind of dealt with it for many years, and just that became her new norm.
Okay, gotcha.
If your fibroids aren't bothering you, you don't have to do anything.
All right, Sharon, any last words?
I know the onus should be on the patient, the women, right? You have to ask the right questions, advocate for your own body, but the doctors, and you're a great doctor, Dr. Patel, the doctors, shouldn't they be asking and soliciting this information out of their patients? Are you having heavy periods? Are you missing days at work?
Especially if you're black and you walk in.
Well, this is what I'm saying, okay?
Right.
In a nutshell, what he said.
Yes, it's the doctors should be asking these questions, even in family history. If you say my mother had a hysterectomy, then you have to think why did she have a hysterectomy if it's 30, 40 years ago.
And we got to talk about that in families, because a lot of times your mom might not even tell you certain things.
Yeah, and a lot of my patients, they just know their moms had hysterectomies, but they don't know why. But lots of times it is for fibroids.
All right, Dr. Neel Patel, thank you so much, doctor, for coming in.